The latest survey results confirm what many have feared. Medical care in the United States remains out of reach for millions, and the problem is getting worse. With 11% of Americans reporting they couldn't afford necessary medications or treatments in the last 3 months, the situation is deteriorating rather than improving. More than 91 million adults acknowledge that if they needed medical care, they wouldn't be able to pay for it, revealing a deepening crisis that extends beyond any single policy decision. While rising costs in other areas, such as food and housing, have captured public attention, healthcare expenses continue to silently devastate individuals and families, often with life-threatening consequences. The survey highlights the stark and growing disparities across racial and economic lines, with Black and Hispanic adults, as well as those in lower-income brackets, suffering disproportionately. A staggering 25% of Americans earning less than $24,000 a year reported being unable to afford medical care, a reminder that the most vulnerable continue to bear the brunt of an increasingly inequitable system. Meanwhile, wealthier Americans and white adults reported little to no change in their ability to afford care, reinforcing the notion that the crisis is not felt equally. This affordability crisis has multiple culprits, including ever-increasing insurance premiums, higher out-of-pocket costs for medical visits, and most significantly, the rollback of Medicaid coverage. The Trump administration, along with Republican lawmakers, has signaled support for slashing Medicaid funding and eliminating tax subsidies that help lower the cost of Affordable Care Act plans. If these cuts proceed, experts warn that even more people will find themselves without coverage, pushing the country back toward pre-ACA levels of uninsured individuals. The financial strain of medical expenses is not a theoretical issue. It is a reality that forces millions to make painful choices between basic necessities and life-saving treatments. Unlike skipping a luxury purchase or delaying a minor expense, avoiding medical care can have devastating, irreversible consequences. Medical debt already cripples countless families, and further reductions in government support threaten to worsen an already dire situation. While there have been significant strides in expanding coverage under the Affordable Care Act, the fundamental problem remains. The United States is not a country where healthcare is affordable. Even for those with insurance, coverage gaps leave many struggling to pay their medical bills, forcing difficult decisions about whether to seek treatment or endure their conditions untreated. The potential for further Medicaid cuts and subsidy eliminations only underscores how fragile the system is for millions who depend on it. The warning signs are clear. Without intervention, this crisis will escalate, leading to more preventable suffering, medical bankruptcies, and deaths. The increasing financial burden on ordinary Americans is not just an economic issue, but a moral failing of a system that continues to prioritize profits over people.